Hello, everybody. Welcome to Real Talk with Nurses. I am your favorite nurse Dean, and today we're going to be bringing real activities, real experiences of nurses to you. In my midst, I have a very beautiful nurse that has been not just a friend but also a sister. Most times, some people be like, you people look alike. Don't we look alike?
Yes, of course we do.
And she's going to be telling us a lot. So, can we hear your name?
I'm Nurse Chizoba.
Okay, Nurse Chizoba. And if you see the way she's even pronouncing the D, you know that. Okay, so welcome, Nurse Chizoba.
Thank you very
Thank you
much.
so much for granting this privilege in a very short notice. So in this series, I'm going to be asking her a few questions. She'll be telling us about her experiences so far, and I believe that at the end of this, you as a nurse, you have something to say about it, whether your own experience that you're willing to share. And yes, by email will be dropped in the comment section just in case you want to be featured in this series. You can reach out to me in the email. Sit right there. Let's dive right in. Okay, guys, welcome back from that short yet interesting break. I hope you've grabbed your popcorn because we're here to blow your mind.
Interesting.
So, Nurse Chizoba,
Yes.
the first question on my list for you today is, how long have you been in nursing?
Okay. I've been in nursing for, I would actually say almost all my life. I've always been a caregiver.
Oh, that's nice.
But I got licensed and qualified. That's according to the standards. 7 months now.
Wow,
So-
wow, that's impressive.
Yes, I deserve a round of applause.
Nice one. Congratulations.
Thank you
to
very
you.
much. Thank you.
Okay, so the
Thank
next
you.
question I'm going to be asking you is what really inspired you? You know, you cannot just say you woke up one day and you decided, oh, I'm going to be caring, I'm going to become a
Yes.
nurse. So what exactly inspired you to go through this path, nursing? Because nursing is difficult.
All right, that's a good question. Actually, it wasn't just a wake up and you realize that okay, I'm supposed to be a nurse.
Yeah.
There was never a moment like that. It's been different times, moments all through my life so far that have made me sit down and realize that, and with the guidance of my family played a good role. Shout out to my elder sister.
Oh,
Yes,
elder
they played a good role towards directing me, but I've always been a caregiver. I used to take care of my grandparents when they were alive. As young as primary school, I was so good with that.
Wow.
I would always remember his drugs. I would always give him
Wow.
the drugs.
Wow.
So they always knew me as the one who would stay home with grandpa and take care of him.
So basically, we're going to be saying you were born for this.
I was actually born for it. I was running away from it, but with time I had to, with the guidance of my family, I had to take the bull by the horns, and it's been an interesting ride all
So
the,
it's just
all the
as
way
good as
so far.
saying you cannot run from nature. Stop running.
No, you cannot. You
Stop
cannot.
running.
You cannot run from your
You know,
destiny. It's always there.
I actually used to give myself this excuse. I'm scared of blood. I'm scared of this. But me.
I've actually never been scared of blood.
Oh, really?
Yes, I've always been the courageous one. But at the end of the day, I would sit back in my room and start thinking all over what happened, and it will affect me. But
Okay.
it's been there.
Yeah. I'm so glad that at least you took this step. And I believe that you are.
Thank you to my family. I say thank you to my family every time.
How well did your training prepare you for real world practice? Because one of the things that I know basically is that no be wetin they do for inside class, what they do for work. So are you going to tell me that you were totally prepared for what you're saying now in the hospital setting?
I wouldn't say I'm totally prepared, because I've come to realize going through life that you can never be perfectly and totally prepared. You learn about life and about things as you're living it, as you're going on.
That's right.
So in terms of preparation, I would say 80%. I allowed school to go through me, and I went through school. I tried as much as possible to participate, and other events that happened throughout my training, in one way or the other. In fact, in a lot of ways, they've all come together to make me the nurse I am today. Okay. My sister will always tell me when I complain about the academic workload then in school, she will tell me that you can never be taught everything. You teach yourself, you open yourself for the world to teach you.
Nice one.
Yeah.
So you're trying to tell us that it's not just the experiences you learn from classes.
Yes.
I know that there are also some lecturers that they don't just base on what this is what this book is talking about. There are some of them that they dedicate themselves to telling us, oh, this is what this particular topic is relating to this experience they had in school. So
yes,
I believe that you also have that kind of teachers.
Yes, and the summary of the whole thing is the real education is out there in the world and not in the four walls of the classroom.
Not just in the classroom. So the next question I'm going to be asking you is, I've not really been that long. I've not stayed so much in nursing. This should be 2 years plus. 2 years plus in the nursing profession. And I can say, based on this, I can categorically say, oh, this is the path I want to go through. So I don't know if it's too early for you to be answering us, for you to be saying, okay, this is the area of nursing that I'm most passionate about. So can you tell us, is there something you're most passionate about, or you want maybe in the next 5 years you want to be an ICU nurse, or you want to be a midwife, or something like that?
Nursing is a very vast field. Very vast field.
Very vast.
And personally, I am a multi-talented person. Aww. I like to experience life and every facet of life. So I don't think I am ready to fix myself in a box of ICU nurse, midwifery. I want to have a taste of everything. But generally, I would like to go into nursing administration. Because there are a lot of things in nursing practice that needs to be corrected from administration. So by the time I would have the taste of almost every part of the clinical nursing, I would then gradually transition into nursing administration.
So basically, you're telling us that now what you're doing is testing the mic.
Of course.
Okay, so the next question I'm going to be asking you is, can you share a memorable patient care experience you've had?
Oh, really?
Because I know that you definitely have worked with a lot of patients, owing to the kind of hospital you work in, which is always busy.
Okay, yes. A lot of patients, every patient leaves an indelible mark in your heart.
Fact.
Yes. So my unforgettable experience is the patient, a lady, the very first labor and delivery experience I had.
Oh, wow. This story is going to be interesting.
The very first labor and delivery experience. The woman, the labor started off as a little pain after 10 minutes, intermittent pain after 10 minutes. Gradually, it progressed.
Okay.
Gradually, it progressed, and it was a very dramatic one.
Oh my God.
The woman was a very dramatic patient. At the end of everything, when she was holding her bundle of joy, she was now the one recounting all the drama all the drama she displayed. She was the one recounting it, and we are now making fun of it.
Oh my God.
And she appreciated us, the nurses.
This is the part I like.
Financially.
Oh my God.
I think, it was a very fun experience to see that after all the pain that this woman carried her baby, and in a matter of minutes, just about an hour after she was screaming down the hospital, she was already smiling, looking at her baby.
This is so good. And I believe that one of the things that makes it indelible in your life is that you were opportune to bring forth the baby. Live.
I walked through the labor.
You were there.
The labor processes. By the time she gave birth, it was already the end of my shift. But I decided to stay beyond my shift. I didn't go. I decided to stay beyond to watch this woman deliver, and it was a wonderful one. It was a wonderful one.
I recall the first experience I had with a delivery. This woman literally had to turn me into her husband. She was like, "Nurse, please can you massage my back?
Here.
Nurse, please can you massage my waist?"
She almost tore my uniform that day. At the end of the day, she was happy.
Yeah.
And the baby was a very healthy, handsome baby boy. So
that's the most important thing. The most
Yeah.
important thing is that even after all the stress, after everything you have to go through, you end up bringing that life. You end up giving joy back, and that is definitely our hallmark in nursing.
of course. Yeah.
So, the last question on our list for today is: I know that there are lots of procedures that you carry out in the hospital. Can you tell us your best, and can you tell us your worst? And then we also want to know why is this your best, and why is this your worst? Okay.
I'll start with my worst.
Okay. Better the bad news first.
The very worst.
The bad news first.
I'll start with that first. I sincerely hate last office.
Oh my God.
Last office. The last thing you do when somebody dies, I hate it. Especially when this patient is somebody that you've nursed over a while and you're really praying, anticipating that this person gets well. I think the procedure that I like so far, I love a lot of procedures anyway, but I think this one stands out is medication administration.
Okay.
Because during that time of administering medication, the patient gets to ask you a lot of questions.
Okay.
It's a form of interactive session with the patient,
Nice.
especially patients that are stable already. Yeah, they get to ask you questions.
They want to know what you're doing.
Yes, they want to know what you're doing. So the process of teaching them about the medication and the aftermath of gaining their trust and gaining their cooperation, it makes that medication administration worthwhile. It makes it very exciting for me.
Yeah.
And at the end of the day, you find out that these drugs that you've been giving to this patient, they've been doing wonderfully well. The patient's general condition is improving.
I'm so excited. Thank you so much.
The pleasure is all mine.
Being here
Thank you
with us.
for hosting me.
I know we learned. Okay, sorry. Is there something you would like to, let's say, tell nurses out there?
Nurses out there, nurses in the training, we are wonderful. We are wonderful.
Okay.
Nursing, despite the hassle, the stress, the burnout, nursing is a very important profession, and it is really satisfying. Good. A very satisfying one. So I'll say kudos to all nurses.
Okay.
I'm proud to be a nurse. And I really hope you are proud to be one as well.
I'm proud to be one. No, I don't know about
I really pray you're proud to be one as well.
Okay.
So let's keep making the world a better place.
Nice
generally, because our roles are not confined to the hospital. We are multifaceted. So let's keep making the world a better place.
Thank you so much. If you watched to this part, I know that you have a reason to be thankful for watching this video today. The keyword is do not give up. Keep pushing. Nothing is satisfying. If you want to be featured, make sure you drop a comment, or you can send me an email directly. I'm going to be dropping my email at in the comment section. So, and don't forget to like, share, and subscribe to my channel. See you all in my next video.
Hello, bye.